Hi, this is Wang from Binghamton University. I'm presenting for our research, co-designing an AI chatbot to improve patient experience in the hospital, a human-centered design case study of a collaboration between a hospital, a university, and ChatGPT. Our team also includes Samar Abubaker, Christy Babalola, and Stephanie Jesso. Patient experience has emerged as a vital component of healthcare quality, linked to clinical outcomes and hospital reputation. Patient feedback survey has been used as a traditional method of gathering patient feedback. However, it has shown limitations, including low response rates, biased samples, recall errors, and ineffective timing. Chatbots could be used to engage patients in natural dialogues and has shown the potential as a tool for collecting patient experience data to support real-time assistance. The research goal of this study is to co-design with a hospital to develop an early-stage chatbot application which could assist them with collecting more valuable and informative data on patient experience. The study is also to find out empirical insights into the desired functionality and the potential value of chatbots for improving patient experience in hospital. To fulfill our research goal, we use a human-centered design cycle as a basis for our research and design. In our first iterative design cycle, we first interviewed a hospital patient experience team and gathered design feedback. Our interview focus is to find out how the patient experience team currently assesses patient experience, how they gather data, the major features they think about, and also what they would desire from an ideal patient experience surveying tool. In our study, 3 investigators used 9 interview questions to interview 4 participants. Based on the interview results, we conducted a content analysis and found 7 codes. The first one is data collection, such as using third-party services to collect the data. The second one is user experience, such as interaction with existing analysis tools. The third one is patient experience influencing factors, such as courtesy of staff. The fourth one is patient characteristics, such as patient's age and gender. The fifth one is data analysis, such as the increase of grievances lead to the decrease of satisfaction. The sixth one is types of data, such as survey likelihood measures. The last one is sharing findings, such as feedback to individual staff member. For our inter-rater reliability measure, all Cron's kappa value are greater than or equal to 0.94 for each code. For the analysis of interview results, we gained the understanding on current situation. We found that the targeted hospital has used third-party platforms to increase access patient experience data through social media, and also has used a third-party service for survey analysis. However, the targeted hospital cannot collect much data or use a real-time response feature. Based on this, we came up with the initial design concept. We want to create a new form of data collection that is through a web or app-based chatbot that could respond in natural language to encourage users to share their hospital experiences. The intended context of using this chatbot application is in the hospital or emergency department so that patients could describe their experiences more fully as they were occurring. Patients can access this chatbot application through their phones or hospital tablets. In the second iterative design cycle, we mined the patient reviews, perform a qualitative analysis, and developed 3 AI techniques to code natural language from patients. We collected patient reviews from 4 UHS hospitals' Google Map profiles. Among these hospitals, we find the UHS Wilson Medical Center has the most number of non-5-star reviews. Thus, we further extracted 159 reviews with 1 to 3 stars to identify patient complaint types. In this study, 2 human investigators worked separately to do semantic analysis on these reviews. We found 7 complaint themes. The first one is missing essentials, such as complaints about missing food, bathroom, and wheelchair. The second one is quality or safety concern, such as the patient was given wrong medication, the staff use of dirty gloves. The third one is professionalism or competence. For example, the patient complains about a rude staff. The fourth one is comfort in facility, such as the room is small or lack of privacy. The fifth one is waiting on tests, such as a long waiting for a CT scan. The sixth one is waiting on treatments, such as the treatment is rescheduled by nurse. The last one is waiting on clinician, such as long waiting for a doctor to come. For our inter-rater reliability measure, all current kappa values were greater than or equal to 0.73, except waiting on tests. It should still be noted that kappa values greater than 0.61 shows substantial agreement. We then also applied 2 machine learning models for semantic analysis. One is CNN model set up with 1 embedding layer, 1 one-dimensional convolutional layer, 1 pooling layer, 2 dropout layers, and 2 dense layers. The other one is LSTM model set up with 1 embedding layer, 2 LSTM layers, 2 dropout layers, and 2 dense layers. We trained the binary classifiers for each theme using the labeled 159 reviews by human investigators. Here, training set contains 115 reviews, and testing set has 44 reviews. We also involved ChatGPT to code patient reviews. Our ChatGPT prompt is designed with 2 components. One is theme definition by human investigators' understanding. The other one is to give ChatGPT possible context examples that it will encounter. The right table shows the ChatGPT prompt for missing essentials that our study created. We took human investigators' coding results as ground truths. The table shows the theme labeling performance by ChatGPT and machine learning models. We can conclude that ChatGPT had a best overall performance. Also, a mixture of experts' approach could be used to improve performance and achieve a closer match to human judgment. Finally, based on the insights from these 2 design cycles, we developed a patient-facing AI chatbot which recognizes complaints and can respond in natural language. We applied an open assistant llama-based model pre-trained with large amounts of messages in 35 different languages. This AI chatbot can engage patients in longer interactions to elicit more data about their experiences. The future work is to continue co-design and evaluation of patient experience chatbot and to design the user interface of the chatbot application further. You can interact with our AI chatbot through the QR code or access link here. Our study learned several meaningful lessons. The application of ChatGPT and machine learning models led us to conclude that this is a promising method for automatically tagging relevant kinds of patient experience issues. It is necessary to create a programming to repeatedly prompt ChatGPT in a certain time span to ensure it won't lose memory on prompts. Compared to traditional machine learning models, ChatGPT achieved better overall performance and did not require us to provide any training data. I express our appreciation for your attention of this presentation. We thank our participants for sharing their valuable insights with us. We thank our collaborator at UHS who will continue to partner with us as we improve our prototype. We also thank our reviewers for their constructive feedback on this research. You can visit our project page to read more information and contact us if you have any questions. Welcome to read our paper and connect with us at CHI.